Hi, Robyn.
Yeah, hi.
My name's Amy. I'm a level 1 student, and I'm actually going to be shadowing you today, if that's okay.
Oh, yeah, that's fine.
I understand you're working on a patient right now?
Yeah, I'm actually looking up Mr. Litt's chart currently. If you want to come over, I can show you a little bit of information about him.
Okay, I'd love to get an SBAR report.
Yeah, so he's a 67-year-old male. He was admitted a couple days ago for a decubitus non-healing ulcer on his right heel, and then he also expressed some issues controlling his glucose. Usually he keeps it in the 120 levels, but recently it's been up in the 200s, 290s. So that's a little higher than we'd like it. He's a full code, and he is 171 pounds. He's 5'11". His last round of vitals said that he had 16 respirations per minute. His pulse ox was 96%, his pulse was 76, his temperature was 98.4, his blood pressure was 128/70, and again, that's a little higher than we'd like it, but we'll talk to him about that later. And then, as I told you, his glucose has been a little bit high. We just took it at about 8:30, and it looks like it was 242, which is definitely way out of the range that we're looking for. Usually we like to control it between, well, normal glucose range is 60 to 100, but usually we like to keep it anywhere between 80 and 90, so we're going to try to bring that down with some insulin. Let's see, no known allergies. He has a right saline lock, or a saline lock in his right antecubital space right here. And he denies tobacco use and drug use, and he usually drinks like one beer on Friday when he's bowling with the guys, and usually we take that with a grain of salt, but we'll believe him this time. And let's see, I told you with the non-healing wound on his right heel, tried to soak it in salt water, but it hasn't been healing, so that's why he's here. Yeah, that's about it. I was going to go ahead and give him his glucose. Would you like to, or sorry, his insulin. Would you like to watch?
Yeah, I actually have a couple questions, though, first,
Oh,
if that's okay.
Sure.
Now, why specifically is this client receiving this medication?
Okay, so this client is a type 1 diabetic, so he, again, has trouble controlling his glucose levels. And as I said, his recent glucose level is 242, so we're going to give him some insulin to try to control that and bring it down into a more acceptable range.
What action does the medication have on the body?
Well, he's actually getting two different types of insulin, but they do work about the same. He's going to get the NPH and the regular insulin, and both of those work to draw the glucose out of the blood stream and pretty much help it get into the muscle cells and the fat cells.
Okay. Now, when should you question administering this medication?
You definitely don't want to give insulin if your patient is exhibiting any signs of hypoglycemia.
Okay.
So if they're dizzy, confused, you've heard cool and clammy, right?
Yes.
Diaphoretic, if they're sweating, anything like that, definitely want to hold off.
Okay.
Do another AccuCheck if you need to just verify that the first one was correct. Yeah, that's pretty much the only time you'd want to hold it.
Okay. Now, does this medication have a therapeutic serum level?
It doesn't really have a therapeutic serum level. It's not something that you have to continuously get to build up in the bloodstream in order for it to be effective. You can just kind of give it.
What vital signs should you monitor with this medication?
Again, all of them, because when you're hypoglycemic, you're going to have erratic heartbeats, you're not going to have the best respirations, just pretty much everything's going to be affected. So make sure you're constantly assessing.
What physiological parameters should be monitored when the medication is being administered?
Glucose levels definitely need to be monitored, as is the level of alertness. Definitely ask your patient a couple questions to see if they're confused or anything like that. And again, I told you you're going to look for signs of hypoglycemia, so sweating, coldness, clamminess.
Okay. Now, what interventions should you teach the client to ensure the medication is being administered safely in a hospital setting?
So many things. So for the patient in the hospital setting, you want to make sure that they know what doses and what medications they're getting, and also when they should be getting it. For the insulin, you want to make sure that they're aware of what their glucose level is and sort of use that to teach them, okay, if your glucose is too high, you definitely want to make sure you're controlling it, and that'll help reinforce that behavior at home as well. So make sure that they're aware of the dosage, the medication, and why they're taking it.
Okay.
And also teach them what to look out for, so potential side effects.
Okay. And then what interventions should you teach for the patient to be taking the medication safely at home?
At home, you're going to want to teach them to clean the area before they give themselves the injection.
Okay.
You're also going to want to teach them to rotate sites to help prevent lipodystrophy. which is the scarification of your fatty tissue, which means that when you try to inject the insulin into it, it's not going to absorb it as well. So that'll sort of prevent the insulin from working as efficiently as it should. You're also going to want to make sure that they're aware of what the medication should look like. So if you look at it and it's regular insulin, you know that's supposed to be clear, right?
Right.
So if they look at it and it's cloudy, they know that that means something's gone bad there and they should throw it away and not use it.
Okay. Now, what are the side effects and potential adverse reactions with this medication?
With any type of insulin, the side effect that you're going to want to look out for the most is hypoglycemia.
Okay.
And that just occurs if you give them too much or if they're sensitive to it. And that's when their glucose level will tank.
Okay.
They'll start getting dizzy and sweaty and cold and clammy and all that terrible stuff.
Now, how will you know that the medication's effective?
Usually you want to check their glucose level again, so you do another IQ check. And for these particular insulin, since it's NPH and regular, we're going to go in about an hour after we administer it and double check the glucose levels to make sure it's working.
All right. Well, those are all the questions that I have for now. I don't want to hold you up anymore.
Oh, no, it's fine. Questions are great. All right, so we're going to go ahead and see if Mr. Litz is available.
Okay.
Hello.
Hello. Hi, Mr. Litz. This is Robyn, your nurse, and I brought a nursing student. This is Annie.
Hi.
Yep. I just wanted to let you know. Oh, Annie, can you look out, please? I know, tight quarters, right? I just wanted to let you know we just did a glucose IQ check for you, and it looks like the last one we did was at 8:30, which is about, let's see, what time is it? Oh, it was about maybe half an hour ago, and it looks like your glucose level is 242, so that's a bit high.
That's a little high.
Yeah, so we're going to go ahead and give you some insulin. You're going to get your NPH, and you're going to get some regular, and I'll have to look up the regular because I know it's on a sliding scale.
Okay.
So just give me 1 second. And while I'm looking this up, can you tell me your name and age?
I'm Greg Lutz, and I'm 67 years old.
Okay, and how are you doing today?
Doing good.
I know that we gave you some morphine earlier for your heel because it was hurting a little bit. Is it feeling a little bit better now? How would you describe the pain on a scale of 1 to 10?
Well, on a scale of 1 to 10, I'd say it's about a 1.
Awesome. Excellent. Well, let me know if it starts going up again, okay? And we'll try to get that under control.
No problem.
Alrighty, so I'm pulling up your NPH. And it looks like you're going to get 20 units of that. And then based off of the sliding scale, let's see, it was 242, so that would be 16 units of regular.
Okay.
And do you have any allergies that I should be aware of?
No.
No? No allergies?
Nope.
Alright. And where was the last place that you got your insulin injection?
Right here.
Right here on the left side?
Yep.
Okay, I'm going to go ahead and put it on the right side of your abdomen then.
Okay.
And then can you tell me a little bit about how you've been administering the insulin at home? Do you clean the area before you inject yourself?
Yeah, I use just regular soap and water.
Excellent. Yep, that's what you should be using. And you know to rotate sites, correct?
Yeah, I still want different parts of my stomach.
Do you use a checkerboard pattern when you do it, or do you just go in a cycle?
Just pretty much a random cycle, but I try and avoid the area that I glass gave it in.
Okay, yeah, sometimes it's easier to keep track of if you're doing a checkerboard pattern. So when you do it, if you just kind of zigzag your spots, that way you can kind of go in the same pattern, but it's easier to keep track of.
Oh, that makes sense.
Yep. So let's see, just double check what I'm giving you, NPH and regular. Just pull that out. Got NPH, and then let's get your regular insulin. How's the bowling going? You still going every Friday?
Yep. Last week I got a turkey.
Yeah?
Mm-hmm.
That's better than I can do. I can't break 100, which is sad. There's one time I actually was bowling and I had 99 and I still had 3 frames to go and I gutter bowled it each time. It's awful. So embarrassing.
It's horrible.
I know, right? So bad. Okay, so Annie, you can see I verified the doses.
Okay.
And right now what I'm doing is I'm going to actually wipe off the bottles. I'm sure your instructors have told you clean it
Clean
like
it
you
like
mean
you
it,
mean it.
right? And that one again is the regular insulin. And I'll just put it there so I know I've wiped it. Wiped it. And how are you feeling? You don't have any dizziness or anything like that right now? Any confusion?
Nope.
Not sweating profusely?
Nope.
Nope. Okay. No tingling in your extremities?
Nope.
Excellent. Okay, I'm going to go ahead and start scanning your wristband. Matthew wristband, please. Thank you. And you are the NPH. Excellent. Okay, and you can see it turned green, Annie, so that's how you know that it's the correct medication.
Okay.
Okay, and then I'm sure your instructors in level 1 have told you already, but what you do is you have to actually inject air into each vial first,
Okay.
because otherwise it creates a vacuum and you can't get any of the insulin out. It's just awful.
Got it.
So let's see, since we're giving him, 20 units of the NPH and 16 units of the regular, that means we're going to do 20 plus 16 is 36.
36.
Does that look like 36 units of air to you?
Looks like 36 to me.
Okay.
I approve.
You agree?
Yep. That's good to hear.
And again, that's the NPH that we're going for first. Okay, so then we're only going to inject 20 units of air into the first one. And then we're going to inject the rest, so the 16 units, into the regular. And then you can just go around and flip it up. You're going to draw up your 16 units regular.
And that's the clear to cloudy is what I've heard?
Yes, ma'am.
Okay.
Sounds like you have some pretty good instructors.
Oh yeah, they're great.
And then you want to flick it to get that air bubble out, so you usually drop a little bit more.
Okay.
And then you can go and push it all back in. Okay. So that way you can see you have 16 units, the regular.
Looks like 16 to me.
You don't have any of those awful air bubbles
No.
either. Okay, and then you're going to go ahead and get your NPH. And again, that's 20 units. And you saw that I rolled that NPH before when I was taking it out of the drawer.
Yeah,
You see
why
it's
do you do that?
It's a suspension.
Okay.
So if you don't roll it in your hands, it's actually not going to mix, and then you won't be getting the medication when you draw it up. Okay, so now we're going to use the scoop method. I'm sure your instructors have stressed the importance of that as well.
To avoid getting stuck with those needles.
Yep. Okay. So, let me just go ahead and finish getting this in here. And then when you're charting, it's always good to say like where you're injecting it so that the next person who's injecting it can verify with the patient.
Okay.
And that way you're not doing the same site over and over and over again.
That
That'll
makes sense.
prevent the lipodystrophy, which is why, Mr. Luke, that's why you rotate sites.
What's that?
To prevent hyper... It's okay. Lipodystrophy, where you have the buildup of the fat. So I don't know if you've noticed in any particular region of your abdomen that you've been using frequently, if you've started to get sort of scar tissue anywhere. I haven't seen any on you, but something you want to look out for when you're administering at home.
Okay.
All right, and then I'm going to need your wristband again. Thank you. And then when you're at home, do you pre-mix your insulin at all? Like, do you mix it in the syringe?
No, I have pre-mixed.
You have pre-mixed. So you use one of those pen units?
Yeah.
Okay, that's cool. That'll probably be easier for you too, because I know you have some vision problems,
Yeah.
and that'll make it way easier for you. Okay, so I'm going to go ahead and start cleaning the area, and just for, posterity's sake, what is your name and your age, and do you have any allergies?
I am Greg Lutz. I'm 67 years old, and I have no allergies.
And it's good to keep talking
Ooh,
to your
that's a little
patients. I know it's the alcohol. It's not as nice as your soap and water, I'm sure. But it's good to keep talking to your patients to make sure they don't suddenly become hypoglycemic. It's been known to happen, just with this one. So.
What?
All right.
You wish your other patients were as good as I am.
That's quite true. Not all of them are as spirited. All right, so you're just going to feel a prick. And then you usually just leave it for 5 seconds to make sure everything's getting absorbed.
Okay.
And then toss it directly into the sharps. That wasn't so bad, was it?
Nope.
Nope, no bleeding. Alrighty. Is there anything else I can do for you today?
Nope. I think I'm good.
Good. Well, since there's nothing that you need right now, I'm going to go ahead and teach you about a diabetic diet. And we're also going to talk about that sodium restriction.
Okay.
So when you go bowling with the guys, what sort of food are you eating?
Usually I eat pizza and maybe a couple of those hot pretzels with cheese sauce and beer.
Yeah. That's what I
Or two.
thought. And those types of foods, especially those pretzels, have a lot of sodium on them. Because you know you're supposed to be sticking to your 2-gram sodium diet.
I save up the 2 grams for bowling.
Do you? Do you just eat salad without dressing every single day?
Oh, absolutely.
I
That's
don't
how
know
I got
about
this
that.
wonderful physique.
All right, well, I'm going to actually give you this lovely 1,800 calorie diabetic diet, and that'll talk a little bit about the different types of foods that you can have, and you can
Okay.
see it actually gives you some of the nutritional content for it as well.
Okay.
So that'll help you make some better food choices to sort of control your sodium and your carbohydrates and all that good stuff.
Do you have any recommendations off of this?
Off of that, I know that it definitely recommends all the yummy vegetables. You can have broccoli and cabbage and carrot.
My favorites.
Oh, I'm sure. If you want, I can see if I can find any good recipes for you on my off time, and we can work with that. I can also
That would be awesome.
get you in touch with a nutritionist who might have some
That would help.
ideas on
Yeah.
better ways to incorporate those into your diet. And I know that you were having some trouble taking care of your foot, just because of the ulcer and
Mhm.
everything. So I brought you this pamphlet on diabetes and foot care.
Oh, thank you.
Yep, and you know you're supposed to have a podiatrist cut your toenails, right? You're not supposed to do it yourself. That'll help prevent infection.
Okay.
Yep, so if you want, I can go ahead and get a hold of a podiatrist that you can talk to as well, so you can start scheduling foot appointments, and hopefully that'll help take care of your foot in the future.
Okay, that sounds great.
Okay, is there anything else I can get you?
I'm kind of thirsty. Some water would be great.
Some water?
I'd be happy to get that for you.
Thank you,
Thank you,
Annie.
Annie.
All right. Well, thank you so much for letting me have this level 1 nursing student watch me give meds.
Not
Thank
a
you very
problem.
much, Mr. Lutz.
Oh, you're welcome.
Primary diagnosis is the stage 2 diabetic
Just
ulcer.
finish
on his
charting
right heel.
here.
That's why he has a medium fall risk. For his secondary diagnosis, his is diabetes mellitus type 1. For all the assessment, I have for his neuro, his is oriented type 4.
Okay, actually, can I grab your hand one more time? Thanks.
He's in low
Your autograph.
Maybe later, Mr.
His
Lutz.
is paralyzed 4 millimeter bilateral eye wrist and constrict.
Maybe you could get all strikes.
He has
All strikes.
Win that bowling trophy.
I'll work on it.
No, he has no problem hearing. His sound and nerve are good condition. There's no lesion or short teeth in fair condition. His intensity of pain when he came here is 6 out of 10, but then we give him morphine at 410, and his rate of pain is
Oh, and just so you know, we're going to come back in an hour. I know you have a food tray on the way, or at least that's what dietary told me. So it should be here in the next 10 minutes or so. So I'll be back in an hour, and I'm going to double check your glucose, doing an Accu check, just to make sure that insulin's working, okay?
Okay, that sounds good.
Respiration is 16 breaths per minute. O2 saturated is 96%. His capillary field is
Alright. And Annie will be back with that water for you.
Do you want ice in that water?
Yes, please.
Okay.
See you in an hour.
Yeah. Enjoy your food.
Apical pulse is regular pulses in every 6 beats per minute. His blood pressure is
I'll just go ahead and close the door for you.
Thank you.
You're welcome. Alrighty.
So I do have a couple more questions for you, if that's okay.
Yeah, of course.
Now, were there any pertinent pieces of information that you reviewed before administering the client the medication?
Yep, you saw how I asked him where he last got his injection. And again, that's to prevent lipodystrophy? Thank you. And so that way, if he just got an injection, in the right upper quadrant of his abdomen, you're going to want to do it somewhere else.
So
Just
that
prevent the scar tissue.
kind of answers my next question and
Oh,
why
okay.
it was important.
Yeah, and then you also saw I was talking to him the whole time, just asking him if he was dizzy, if he was feeling any strange sensations that he didn't normally feel. Those things are very important to note, just because hypoglycemia doesn't present universally, so good to
Okay.
check.
Now, did this information affect your decision to administer the medication?
It definitely, well, it did affect it in the sense that it didn't tell me not to administer it, so it was all just making sure everything was green lighted.
Okay.
Yeah.
And did it affect how you administered the medication?
Not really. I mean, you saw that I chose a different location because he had already gotten one in the other side of his abdomen, so just to make sure I went on the right side.
Okay. Well, those are all the questions that I had for you today, Robyn. I really appreciate you letting me shadow you.
Anytime.
And I'm going to get him his water.
Excellent.
All right.
Yeah, and then if you want, you can watch me do the Accu check in an hour or so.
That would be great.
Okay, excellent.
All right. Thank you very much.
You're welcome.